Great. So I think almost everyone is still joining. Few are just left. So we'll begin, okay? To admit that some people literally have no conscience is not technically as saying that some human beings are evil, but it is disturbingly close. A quote by Martha Stout, an American psychologist and author. Good evening, everyone. I, Harshita Bhalla, warmly welcome you all on behalf of Forensic Fusion and Why Crime to today's webinar. Before starting, we have a few general instructions for everyone. You are requested to keep your cameras on and mics muted during the lecture. And for any doubts or queries in between, you are requested, please drop them in the comment section. And you can either raise your hands, and later the platform will be open for any Q&A questions or queries you guys have. Also, it's a humble request to not record the session or take any screenshots, as sensitive case studies and graphics will be discussed upon, which are not for public viewing. I'm thrilled to welcome our guest speaker for today, Dr. Paridhi Billore, respected dignitaries, and all attendees to this interactive webinar on psychopathy and crime. In a series of diverse guest lectures covering various aspects, we welcome you to our second guest lecture and are delighted to have you with us as we explore and unlock the criminal minds. Over to you, Swagata.
Good evening, everyone. I'm Swagata Sheel, the editor-in-chief at Why Crime, and also a part of the event management team. Before we begin, I would like to introduce you all to Why Crime and Forensic Fusion. Why Crime, founded by Mr. Shakil Hassan, is a specialized crime news media house offering internships for forensic and law students that provides hands-on training in case FIRs, RTIs, and in-depth case studies. Why Crime app on the Google Play Store covers categories like forensic, cybercrime, drug crime, and criminal law, apart from daily crime news. The organization has also collaborated with renowned crime journalists from India Today and Aaj Tak and regularly hosts webinars. Currently, we are collaborating with Invisera Forensics and forensic psychologist Ms. Krupa Nishar on an exciting new project which is under development. Over to you, Harshita.
Forensic Fusion, founded by Mr. Swapnil Bhattacharya, is a platform where curiosity meets expertise and knowledge breaks all boundaries. We are redefining forensic science education, making it accessible to everyone, from budding enthusiasts to seasoned professionals. Through cutting-edge content, immersive learning experiences, and expert guidance, we are on a mission to democratize forensic education. Driven by a vision to democratize forensic education, this dynamic startup has rapidly become a go-to platform for students, professionals, and enthusiasts alike. By offering free webinars, educational videos, and engaging content on platforms like YouTube, Forensic Fusion makes complex forensic concepts easy to grasp. The organization's commitment to excellence is reflected in their collaborative projects and the ability to bridge the gap between curiosity and professional expertise. Now, I'd like Swagata to introduce our speaker.
So it is my honor to introduce today's esteemed speaker, Dr. Paridhi Billore, who will be leading us in an engaging discussion on psychopathy and crime. Dr. Paridhi Billore is a distinguished forensic medicine expert with a profound academic and practical background in this field. Dr. Billore holds a Bachelor of Medicine and Bachelor of Surgery and a Master of Medicine in Forensic Medicine and Toxicology. She brings a wealth of knowledge from her roles at Deen Dayal University, and she is currently at the Ramaiah Medical College, where she serves as an assistant professor. Beyond her medical expertise, Dr. Billore is an avid biker, MMA fighter, and a passionate traveler, embracing adventure wherever she goes. She is not only an accomplished educator, but also a published author with numerous articles in the Journal of Forensic Medicine and Toxicology. Her expertise spans crime scene analysis, forensic medicine, and psychological profiling, making her an influential figure in forensic science education and training. Beyond academia, she has conducted corporate training on cybercrime and criminal psychology and trained law enforcement officers, enhancing investigative skills nationwide. Today, Dr. Billore will be sharing her insights with us, promising a session that combines academic rigor with practical wisdom. Please join me in welcoming Dr. Paridhi Billore.
I'm audible to all of you?
Yes, ma'am.
Great. Okay. Thank you everyone for joining today. And first of all, my humble apologies for the initial session where we could not conduct because of again a traumatic incident. So one of our colleagues had met with a road accident, and because of that, he had injured his skull. Another forensic autopsy case. I mean, not autopsy till now. He is alive, so, but is in paralysis state. He is, you know, semi-paralyzed. So, but anyway, we'll discuss today some good cases. And thank you, first of all. You are young, budding, inspiring students, everyone, and who have curiosity. Not just students, I'm seeing from diverse backgrounds, people have joined, and professionals were interested, and I'm very excited to share, some of the cases with you guys. So let us start instantly now because it's pretty late. I won't be taking much long. So let's just and yeah, we'll have one particular Q&A session separately. But in case you feel that this particular doubt is extremely important for me and you might like forget later, then you can ask me. But I would appreciate if you can keep the doubt with yourself for a few minutes, and then we can discuss this later. So everyone is comfortable with English, or should I switch to some other language? I mean, I only know Hindi apart from it. So if you are comfortable, then we can just begin. All right. Okay. So how am I supposed to present it? If anyone can help me with this. Hi. How am I supposed to present? Anyone out of you?
Mark, just beside your mic button,
English, please.
You have an option to share your screen.
Okay. Yeah. Share. Right. Share the screen. Fair enough. Okay. Can you all see my screen now?
Yes, ma'am.
Okay, great. Okay, fair enough. So let us start. Okay. So basically, today we shall be discussing about, of course, the topic is psychopathy and crime. And if you all know, we'll keep this conversation a bit interactive. So if I'm asking some questions, and if you if you know the answers, just let me know. We'll have a discussion on this. So have you all seen this new statue which is unveiled recently? This is in news. Okay. So like what is different in this new statue? What is the new statue says? Like what is different in this particular, new Lady Justice statue? Anyone?
Justice
That
is not blind.
It says justice is not blind.
Okay, so
So
let me
justice is not blind anymore, and it is now able to see everyone without any kind of impairments. As in, like now everyone has got an equal forum where everybody is stood on a ground zero level.
Okay, fair enough. So like you can see that there is the lady is not blindfolded, right? She's not blindfolded anymore, and she's not having that what do you call the sword? Okay, earlier like the justice is delivered. It's blind. It's all based on the the evidence. But now the message which is being delivered is that it is no more just evidence based. It is also that the law is form. And can you see that the statue is holding a book in its hand, right? Okay. So now what does this indicate? Anyone? What is this book actually? What's the statue?
Actually, that is the constitution. Constitution.
Exactly. Right, the Indian Constitution. So basically, it is like indicative that the law is not blind, and they are following the Constitution, and whatever is Constitution is mandatory to be followed. Okay, this seen and heard, it looks very nice and very decorative actually. But when you run to this particular case, okay, let me talk to you about this case. Okay, bad luck. 1 minute. I hope this is not stopped. Okay. So, can you see this screen right now, everyone?
Yes, please, we can see them.
So, Karnataka High Courts acquit the murder convict of rape charges. Recommend. Now, this particular case I described in very brief. So, according to the Indian law, there is this particular, under the IPC. Now it is, of course, we have changed under BNS and BNS, etc., whatever it is. But according to Section 375 of IPC, a rape committed on a woman's dead body is not an offense. Okay, so if in a particular set scenario, if you must have heard about certain famous cases, like there was a case of Nathari murder case. If you many a times what people do, and most of the people who have interest in this crime and forensics, etc., what they do is that they're interested in the headlines of the news. They don't realize that it is beyond that particular case, and that is where this headline makes a very important punch. The issue is that in this particular case also, what happened was there was an auto driver, and he had a girlfriend, and then what he did was he murdered this girlfriend because she was leaving him for some reason, and then because she was leaving him, he murdered her, and then he committed rape on her, which is necrophilia. But according to Indian law, necrophilia does not even come under a category of crime. Okay. If you are putting that logic and setting a precedence to multiple cases, it gives a very wrong implication. You know why? Because then what happens is that a person will be convicted only for murdering somebody. So, for instance, somebody has killed a lady a few seconds ago, and then he commits rape on her. So, he might be charged for murder, not for rape. And if it is not proven that he has even murdered that lady, so he is free of every kind of charge, right? So, what was my first slide, and what is this slide which I'm talking about has a correlation. You know why? Because we say law is not blind, but here you can see yourself that it is. There are certain loopholes in the law which exist till date. And it is not like that only India is having this particular case of necrophilia. In Bangladesh also this case was there. In Pakistan also this case happens. Okay. In other countries like UK, USA, this case happens. But there are very strict laws over there. You cannot commit any kind of activity with the dead. That means preserving the honor of a dead is very important there. Okay, so that means that some kind of laws need to be amended as and when time is coming. Okay, and there's a fight going on for necrophilia, but I don't know if there's any response till now, till date, on this particular matter. Okay, now coming back, so I will start my case, or I'll start my presentation with some serious cases. Now, whatever case I'll discuss with you, see, all of you read reports about some of the other news incidents, like, okay, this is a particular incident of rape, murder, theft, whatever, XYZ. Okay, but whenever you look it through the lens of a particular clinical scenario, okay, and unfortunately in India, many of the cases are not looked through that particular lens because of the lack of knowledge, lack of information amongst first the investigators, जो भी police है, IO है, they are least educated in this particular scenario. I was taking a case presentation in Datia. It's a very small district in Madhya Pradesh. So there the people are like, here the forensic labs are not there. Okay, it was a suicide. We don't know if it's a suicide or it's a double homicide, or if it's a suicide wherein the husband has murdered his wife, and then because the issue is for them it's a simple murder case. They need to just solve it, and then they need to complete the case as soon as possible. But when you look at a particular series of cases, like this particular case, it is now converted into a Netflix series also, The Beast of Bangalore. So this person is known as an Indian predator. His name was Umar. And if you look at the entire history of the person's crime, you'll be surprised and shocked equally. You know why? Because the number of times that he has committed rape, number of times he has committed murders, and he has also, he was successful to escape from the police custody. That is most interesting. Now, because multiple times he was left out, or sometimes he was on, left out on custody. What happened was that this man, he escaped the custody. What happened that this man was able to kill more than 50 women. Okay, and not just kill, he was, brutally raping them and killing them. And also he was, and the problem with this killing and raping is not just that he was doing this act. He also used to collect the lingerie. He used to also collect the clothing of the women. One clinical assessment of this person would have diagnosed him with a clinical condition, which is maybe he had an anti-personality disorder, or maybe he had a compulsion for that. Okay, I would like you all to please research and Google about it. That there is a condition, a medical condition, wherein a person is compelled to commit a particular set of crime again and again, because he forgets the thrill which he experienced in the first crime. Okay, for example, in your brain you have this 3-4 centers. Okay, but the main and the most important center, which I consider important also, is the limbic system. How many of you are aware of the limbic system? Just shout yes or no. Yes, how many of you
No,
are
aware.
sorry?
Yes, ma'am, aware.
Aware about it. Okay, fair enough. So like limbic system is a particular, this entire area wherein you have amygdala and you have the hippocampus. So mostly the emotional intelligence, the rage, the anger, the violence, all the emotional activities are controlled in the limbic system. Sometimes because of an injury or because of any kind of like tumor formation in that particular area, that can also lead to repetitive episodes of particular activity, or repetitive case of violence in these kind of people. Now, because this person is not clinically diagnosed ever, he was just taken to custody, interrogated, and then maybe he was then, how was he able to escape so many times? This is something to be thought of. He had manipulation skills. Then what happens is, apart from clinical diagnosis, one should also understand the psychological diagnosis of the person. All these people are very good manipulators. Okay, so many a times you will observe that the criminals are, why are they dangerous? Because they don't appear to be looking like some people who are looking like devil like, or they have like horns or something on their head. No, they look absolutely normal, just like you and me, and they live a perfectly normal life. Like he served for as a waiter for a couple of months also. Nobody could realize that he's the same guy, right? So like you will find that they are very sweet talkers, okay, and they don't have any kind of issue or red flags around them that raise suspicion. So that is their way. They are also very manipulative, and they are also very intelligent to gauge the time. Okay, when the victim would be alone, which kind of victim should I select? Okay, that is coming under concept of victimology. Okay, which type of victim? Okay, what shall be the strength of the victim? How far can I sustain that victim's physical strength? Okay, and is she an easy target or not? What's social atmosphere near her? So all these things are a kind of, they are mapping it slowly, and then they are attacking, because it is not an easy task to commit a crime. You try stealing a 2 rupee pen from somewhere stationary, you'll be caught in a second. But why would this person was committing a crime again and again, and also evading the law? Okay, finally when he was caught, he was given a life imprisonment or something like that. And pathetic system is that he was fined, I think, hardly 20,000 rupees. Imagine, for killing and raping so many women, he was hardly fined 20,000 rupees. So I mean, this is something that also gives a boost to this kind of people, that law in India takes time to produce results. That mentality amongst the criminals boosts them to commit more crime, gives them a boost to commit more crime. Okay, this is not a case of India, but I'll tell you why it is interesting. Have you heard of this ladies? Can you read the name of the nurses? This thing, name tag. What's the name written over
Excuse me,
there?
ma'am.
Can you read the name of the nurse on the name tag?
Sorry to interrupt. Can you try to reshare your screen once?
Slides are not moving.
Slides are not moving.
Now
Can
we
you
can see.
see the second slide now?
Ma'am, I think there's an issue with internet connection, I think.
Right now. Yeah,
Can you see the, sorry?
it wasn't moving. I think it's okay now. It's now moving. The slides are
Okay.
moving now.
Can you see the slide now?
Yes, ma'am.
Yes,
Okay.
ma'am. Yes, ma'am. It is visible.
Can you read the name of the nurse over here? Hi, if you can see the slide, you can see the name of
Ma'am,
the
is it
nurse.
Lucy? Ma'am, is it Lucy?
Yeah, it's Lucy led by, right? So she was actually a nurse who was posted in the neonatal unit department. You understand what's the meaning of a neonatal department, everyone?
Yes, ma'am.
She was posted and she was taking care of the infants and young kids. But in her duty, like there are minimum 11 cases wherein children died suddenly. Okay, and she was responsible for killing all of them because she thought that she was being a kind of person or a person who's a middle person between the god and the kids, and she was sending them back. Okay, and she used to inject the little kids either with extreme saline solution or with high dose of atropine, etc. Atropine is a kind of drug which is used to control or regulate the heart rate. So many a time children used to die. Okay, and maximum children used to actually, and what was her this thing was that she sometimes in her vicinity, and why I'm telling you this particular case, because in India also this incident has happened wherein a male ward nurse, okay, he has led the geriatric patients mean old age people who are not very much able to communicate, etc. So in his vicinity suddenly the geriatric patients used to be suddenly disturbed, or suddenly they were their vitals used to fall and they used to go into cardiac arrest, and then this nurse would be on the duty and then he used to revive them. Okay, now these two cases are different because here Lucy led by, she was acquitted of murdering all those children. She was not saving them, she was literally killing the children. But in case of that man, he was trying to be a savior in this case. Okay, sometimes he could save the patients, otherwise he was like anyway they were old, he died of the cardiac arrest. In such cases, the autopsy is very rarely conducted. Children are there, anything can happen. The most commonest thing is SIDS. How many of you have heard about SIDS? Yes. How many of you have heard about SIDS? Sudden infant death syndrome. Anyone has heard about it? See, I cannot see whatever answers you're typing. I have to go all the way back from my presentation to see your answers. So if anybody knows the answers, you can just speak it out.
Ma'am, could you please repeat once again the term? I mean the abbreviation.
It is sudden infant death syndrome.
Thank you, ma'am. Thank you, ma'am.
Okay. So basically, in this particular case, what is happening is that the nurses and the ward boys are rarely blamed because they can easily fool the people that this child or this geriatric age group patient was anyway going to fall ill, or he was anyway dying. Okay, so in this case Lucy was actually convicted. Right now we'll discuss some other case. This is, can you see the next slide? I have changed to next slide. All of you can see this?
No,
No,
ma'am.
ma'am. No, ma'am.
Let me share it again. Can you
Yes,
see?
ma'am.
Yeah, now it's visible.
Okay, fine. I don't know what is the reason for this. All right. So now in the quota, this case was seen. Okay, and what happened was that this man used to, rape more than 50 plus. He has raped more than 50 plus women. Okay, this is a simple case of mutilation. Okay, whatever we call it, psychopathy, killer, this, that, we use very, very fancy terms every time. The thing is that in this particular case also, one thing was common, that he used to target the worker, the laborers class of the women. Okay, that is most important. Second, why would he mutilate a particular body? Mutilation can be because of multiple reasons. Mutilation can be because of anger, can be because of any kind of curiosity. Okay, it can also be because of any kind of any kind of like intent of destroying the body. Okay, so all these factors are contributing in a person's enactment of all these things. His name is Mohan, by the way. If you'll search about it, you will come to know. Okay, so in this case, the judge has directly said that this is rarest of the rare crime. You don't get to hear about most of these cases, because we see that many of the cases are like, they are highly under the scrutiny, and very rarely the names come out. But these kind of cases are also happening, okay, almost on daily basis. And it is very slow connectivity, because in the police department they don't know that is the same man who's conducting all these crimes or not, because labor class people are there, they report, but then who takes the heat of the cases? Very less number of police investigations happen. But when the crime crosses the rate of 50, 60, etc., then the people are concerned that okay, something is happening. All right, fine. Again, now this is a very interesting news headline for you. Can you all see the next slide, everyone? Brazilian admits to killing Hyderabad woman. Can you all
No,
see
ma'am.
this?
No, ma'am.
Okay. Now, can you see this?
No, ma'am.
Still not visible.
I don't know what's happening.
It's not Be patient.
Wait a minute. Wait a minute. I'm trying to manage something. Oh, I think my screen is visible. I just tried to share my screen. Okay. Now, can you see it? So I need to hear a yes or no, because I cannot hear or see whatever.
Yes,
Yes, ma'am. Now
Yes,
Yes, ma'am. Now it is visible.
Okay. Is this visible? This much is visible to all of you?
Yes,
Ma'am.
Yes, ma'am.
So in Brazilian like one particular news was there that a Brazilian man was diagnosed with already schizophrenia. Okay, and now I want answers from you guys on this particular news event. Okay, please be frank and answer. There is this particular case जहाँ पे एक one particular person who's detected with paranoid schizophrenia. First of all, tell me how many of you understand the two terms paranoia and schizophrenia? Yes, please.
It is a kind of disorder which falls under schizophrenia category, and schizophrenia is basically about an individual experiencing hallucinations and illusions. And as far as paranoid is concerned, so it is basically about being very as in like somebody who often feels that I am the one who is often being targeted by people around me. So if we combine both of the terms, then it becomes a kind of a disorder that is very poor in prognosis, and it is often observed in women, because these are biologically, if we see via MRI scans, so these are basically your four ventricles which are enlarged in nature, and combined with paranoid, it becomes an individual who often experiences hallucinations and often feel that they are being targeted by their own surroundings.
Okay, very good. I think my job is half done here. Okay, you have answered very pretty good. So you can say that yeah, this symptoms in these kind of patients are like they feel as if they are the target of some kind of conspiracy, and they will be killed, or they'll be targeted again and again. And basically, to stop that, they might act or behave in a certain manner which will be like not very social. For example, they might throw something on you, or they may even attack you if they feel insecure, or they feel attacked. Now, here the problem is that this particular thing, okay, whatever killing has happened to an Indian citizen in UK. There, the person was detected with schizophrenia, and he had stabbed the roommate, but he has killed this particular lady. Okay, so I don't have a photo, but what has happened is that the UK has allowed this thing to happen. Okay, and they have just sent this man back to the mental health care facility. Now here, if a schizophrenic man, okay, who has been detected with schizophrenia and has stopped taking his own medications, and because of that he commits a particular crime, would he be convicted in India also in the same manner? Would he be told that, okay, because he is schizophrenic and he is not taking his medication, and because of that he had committed the crime? So actually, he is not a criminal, but he has done this crime in a mental disorder, in a state of mental disorder. So would that be also the case in Indian sense? Would it be like that? Okay, I want answers from you. So if you can raise your hand, it would be good. I can at least understand who is answering. Yeah. Okay. So first, you can say lost due to nature. I don't know what's your name, sir, but you can answer. Yeah. What do you think?
Could you kindly repeat the question, please?
Sorry.
Could you, doctor, please repeat the question?
Yeah, I can repeat the question for you. If a person who is convicted, a person who is diagnosed with a particular mental disorder, specifically in this case, schizophrenia, okay, and if he is committing a particular crime, is that particular man convicted for a charge of murder, or will he be left? I mean, he's not left actually, he's admitted to a mental health facility for treatment. I'm asking a question reason because many of the people who are committing a crime or a murder are claiming false insanity cases or feigned insanity as we call it. And in those cases, what happens is that it is very difficult for the jury to decide whether this man has done this particular crime in a sense of or in a conundrum of insanity, that is under the influence of being paranoid or schizophrenic, or whether he has actually planned the entire thing. And I'll tell you why it is important for you. The people who are specifically in the role of forensic psychologist, or people who are in the role of forensic psychiatrist, their job is to identify whether this particular man has those symptoms or not, which are found in a patient of schizophrenia. Okay, is this particular disease proved in him? Okay, and if he is not taking the medication, fine, because of that he has committed a crime. In that case, that man is left, or maybe he is assigned to a mental facility or mental asylum. But more than that, he is not given any, or is not convicted, or he is not convicted of any murder. Okay, right? So this is very important for all the people who are studying the psychiatric specialty cases or psychology cases, to understand whether the convict is actually lying about the insanity or not. Okay. All right, this we have already discussed. You must be also aware necrophilia is coming under the unnatural sexual offences, but in India it is not logically given the title of a crime, okay, under IPC. So even if necrophilia is being committed, and I think you must have heard about this particular report, okay. In this particular report, how many of you have heard about this issue that here in Arjikar, there was rape and murder of 31-year-old doctor. But there were some instances wherein the case of necrophilia was also involved. Okay, we don't know how much truth is there in this particular case, but certainly in India, because it is not still declared a crime, such cases are coming up. All right, now I'll start the discussion of the first case immediately with you. I'm not disclosing what kind of case this is, but I would like you guys to have your say in this, and then decide what kind of case does it deflect to. What was the cause of the death? Okay.
Ma'am,
So, yeah.
ma'am, I have a question.
Yeah.
Ma'am, the case about the RG case. where the person has been convicted of necrophilia. Uh, Legally, he should be out of jail, but he's the first person to go inside the jail. How do you explain that?
So now see, basically, in the Arjikar case, it is not yet proved that he was the one or not who has murdered the girl. Certainly, and necrophilia has been committed or not, even that is not known. Because if you look at the, if I'll just briefly describe the case for all of you who have not heard about it and who are from other country, etc. So basically, in West Bengal in India, there was a case wherein a 31-year-old resident trainee doctor, she was found dead, and she was not only just found dead, she was found in a dead in a very mysterious condition. So she was raped, and she was smothered, and because of the she had blood oozing out from her private parts as well, and many of the people were saying that her eyes were also hurt and injured in this case. Apart from that, there was an immense fractural trauma which was given to her lower body. Now, in this case, what we are indicating is, and what we have known is, that according to police, there has been, first of all, they reported it's a suicide case. That means there is a trying for a fraud cover up. Second thing is that they have caught a random person whose sperm sample, it is said to have matched, not even sperm sample, I guess. The Bluetooth earphone is said to have matched with the near the victim's body. Okay. The DNA reports are not yet out whether the convict who has been caught in this case and who's inside the jail, whether his DNA report or the spermatozoa report is even matching the vaginal swab of the victim. That report is not out, although it is said that a lot of semen was found which was later disregarded, that it can also be the uterus lining or maybe the degradation of the organs which is coming out after the putrefaction of the body. Okay, so that's a separate issue altogether. So ruling out gang rape or not also is not very clear. Third thing is that there is a people are saying there's an involvement of more than one person in this case. So first of all, the clarity should be is not proven yet whether there is one person involved or there is more than one person involved in the gang rape, in the rape of that lady. Next is that if that offender has committed necrophilia only, okay, then of course he will not be convicted of any of the charges. But it is not yet proven whether he was also not involved in the murder of the lady. The theory says that maybe because he was raping and smothering her, she might have died because of that particular issue also. Okay, so in that case, he's convicted of the murder of the lady. If she was alive and she was raped before she was alive, then the rape charges go. Okay, but if she had already died and then a person commits rape, that is why I'm saying the necrophilia is very much a tricky thing over here, because she was alive maybe a few seconds ago when he started rape and then she died. Okay, so in that case he can be acquitted of rape, and there are techniques to understand this. Okay, the pelvic muscles, the pelvic floor, okay, the discharge of semen, right, till what level was the the sperm was injected inside the vaginal cavity, etc. So there are techniques to identify. The problem is the forensic report which is generated is true or compromised. Okay, so I will not go in that dimension, but that is the only convict that they got in that case because of the Bluetooth pairing issue. Okay, rest they are saying that there are no more convicts. But as you are also sensible enough and you guys are also intelligent, you read the news, you all understand the news, so you must be aware that there are more facts than given in this case. So of course, as enthusiasts, as learners and readers, it is your duty to dig in more in this case and to, of course, see that what all things are not shown directly. All right, fine. Okay, so next,
Doctor, sorry,
yeah,
I have a question.
yeah.
In case this person is suffering from mental disorder, or no matter what type of disorder, does the judge take into consideration that this person has lacks legal capacity to litigate? And does the judge take into consideration that he should minimize the penalty or the punishment?
So basically, in this case, two things are there. It was also said that he had consumed alcohol, okay, and he was in alcoholic state. The problem is that alcohol consumption and then committing of a crime does not hamper your judgment. Okay, it can, of course, it can make you think, or maybe give you a false notion of this is correct or this is incorrect, but you remember about what you are doing. Your memory is not altered. It affects the cerebellum part. In this case, it is not proven anywhere that the man who's convicted suffers from any insanity or severe alcoholism. All right, because it is not proved in any case, we cannot, or even the jury cannot say that this man is suffering from mental insanity, because he knew if a person is mentally insane, he should have an entire history of medications being going on, or maybe diagnosis, or any kind of other grievous violence. Raping a person, that too being a schizophrenia or any other disorder, which is mental disorder, is quite rare, to be very honest. Okay. In mentally challenged person also, it is seen, if you are looking at the medical this thing. So sometimes what happens is that they are not, maybe they are impotent, or maybe they are suffering from erectile dysfunction or some of the other things also. But to connect this to that person might be mentally insane. Okay, in this case, he is absolutely not. He was working in that hospital, and he was a part of the police administration in some or the other way. So yeah, that much is for sure. It's a detail, and there are a lot of things which are covered up in this case. I'll not go much in detail, but anyway, you please read about the case, RG medical case. You will come to know more about the details on this case, right? Okay. Now,
All right.
and the investigation is still on, so there is no solid outcome. Yeah. Okay. So now let us read one particular case. I'll not mention the name of the person. So this 24-year-old male, his body was found in a non-responsive state outside his residence in early morning, and his history was taken. So he was a bachelor. He was living with his friends, but he was also in a homosexual relationship with one of his roommates. Okay, that much is the history that we know. Okay, now here case is very interesting and important, because after the decriminalization of the homosexual activity in India specifically, the case of chronic sodomy combined with asphyxia is very rarely reported. Nobody tries to even investigate the cases, because number one, there's a social stigma attached to it. Okay, a social taboo about it. Second, that the forensic, people, first of all, whenever you reach at the scene of the crime, you see whatever the victim's body positioning is, the crime scene, etc., what the DNA findings, etc., are there. But then the body has to go for the autopsy examination to the coroner or the autopsy medical surgeon, whoever it is. So it is to their knowledge that they have to investigate from each and every angle. Here in this case, it was already known from the history that the person was a homosexual. So definitely a case of sodomy should be investigated in this case, right? Okay. Now if you see, in this particular case, you will observe that there is multiple reddish curvilinear abrasions all over the neck, starting from the neck part till the lower region of the neck. There was an ecchymosis observed. Okay. Second, you will observe that there were multiple pinhead-sized contusions. Can you all see the slide where A303 is written? Hi, everyone. You have to respond, because I don't know whether you
Yes,
can.
yes, ma'am. It is visible.
Okay, good. You can see. Fair enough. Okay. So basically, in this particular case, this ecchymosis was observed. You can see right from the mastoid. So right from this mandibular region to the neck region and surrounding this entire submandibular region and the neck region specifically, there were small pinhead side of contusions were there, but then they increased here. Okay. What is the reason? We'll discuss about it. When the autopsy was conducted, you could see that there are certain findings. Rigor mortis was present. How many of you are aware of this term, rigor mortis?
Ma'am, it is the stiffness
Yes.
of the body.
Yes,
Okay.
ma'am.
Okay, stiffness of the body. Okay, after the death. Okay, so that is
Yes.
postmortem. It's coming under the postmortem changes. So stiffness of the muscles because of the because of the the muscles get stiffened up. Okay. Now next is lividity. Lividity is also the postmortem lividity is very important because when the body is not shifted from one position to another, what happens is the blood pools down. All right, you will observe this common phenomenon in the dead bodies which are for a longer period of time. They have a bluish tinge on the area on which they are lying. The reason being the blood pools down and gravitates down if the body is lying in the supine position. Supine means on the back. Okay, so over there it was lividity was present. There was bluish discoloration in the nail beds. And this is very important. Bluish discoloration. That means the nail beds hai, they are bluish. Can you tell me what can be the reason for discoloration of nail beds? What condition the nail beds turn blue? Yes? Anyone? Anyone can answer if you know. Nail beds, you understand, right? Nails turning blue. What can be the reason for that? No
Ma'am,
idea?
does
I
it
don't know.
indicate being hurt?
Okay, I think I got 2-3 answers. What are you saying?
Ma'am, it can be a drowning case.
Drowning case.
Yes, ma'am, and maybe a
As I said,
suicide.
as I said, this
This
man
is
was
this
found in
is
front of his
called
residence.
Doctor. This is called cyanosis. It's due to lack of oxygen or even due to environmental condition. If it was
Mhm.
too cold and so many other factors.
Okay, so you are saying lack of oxygen, cooling down of body. Okay, so basically what we'll do is we'll understand in this way. So this man, I'll go back to my presentation. Can you all see my presentation again?
Yes, ma'am.
Okay, so basically in this case, what happens is that this man is showing clear-cut signs of the lack of oxygen. Okay, of course. Why? Because the case of asphyxia, you will see it later. Also, you can see this particular picture. You can see that there is a presence of petechial in the subconjunctival hemorrhage also is observed. Okay, and there was also bilateral palpable conjunctiva. That means you can see the slight hemorrhage. Okay, the arteries in the eyes have bursted open, and because of that, there is slight bleeding in the lower part of the conjunctiva of the eyelid. Okay, next is on the face, you will observe that there is severe congestion, and is also multiple reddish contusions in form of bite marks. Now, this is very important. Many a time people confuse that there has been a kind of assault. Okay, you must have observed this in cases wherein there is severe asphyxia. What happens is that the person bites on their own tongue. Okay, and it can be not because of any kind of assault by a third person, but by their own biting on their own tongue. Okay, and this can be seen that the lips are swollen up, upper and lower lip are also swollen up in this particular case. Okay, so this can also happen in case of excessive smothering. So tongue, when it is pushed against the frontal teeth, okay, the entire teeth set, it also gets sometimes it is getting crushed in that procedure. All right, sometimes also the nasal bridge gets broken in smothering cases. All right, so this is another thing. This is dissection, which was dissection autopsy was conducted. So it was found that here there was an extra bleeding in this particular part. Okay, so platysma here, the neck, the below the shoulder, you have this particular area, so platysma and subcutaneous tissue, and in the neck muscle also there was a lot of bleeding. Okay, if you could see the pinpointed, if you could remember this kind of dots over the entire neck surface, what kind of weapon must have been used which would have led to this kind of dots? First,
Ma'am, blunt object?
can you see the side, the sidewise scrapings or some kind of skin removed from both these neck side? What does that indicate?
Bite
Any
Is
marks.
there,
sharp instrument, ma'am?
Type of sandpaper.
Bite
see,
marks.
he is not bleeding from anywhere. Okay, so make it sure it is not any kind of sharp instrument or sharp, like stabbing is not there. Stabbing have penetration.
Blunt ends.
Blunt force?
Blunt force, like what kind of blunt force? Is it a
Bite marks.
straight bite marks? Okay, and bite marks mein, do you see the teeth marking? Because half teeth, so nobody will imprint. Na? You should see a complete round set of teeth. Is it there anywhere round set of teeth? Do you find it?
No. Yes, ma'am.
Right side,
Some hard
Yes, ma'am.
to
Right side.
Right side. Here you are able to find it. Okay. Left
left
side.
side
Even
too.
it might be called
Lower bite
hand.
marks are also
Use the
in the
hand.
left side.
But how can you imprint lower bite
Ma'am,
mark?
some rough surface, some rough
Rough surface. See, you have to try to imagine what the victim must have undergone. That is very important for you to understand. Then and then only you can put your knowledge to use. Just by saying blunt force trauma, I also can say blunt force trauma, but what weapon must have been used to, any differentiating evidence should be there. What kind of blunt force? Was it a bat? Was it was it an X? Was it a rope? Do you see a rope being used here? No, rope may rashes are
No,
being
the marking will be there.
so there is no
Maybe,
manual strangulation in this case. Okay. Do you
maybe
see bite
using the
marks?
hand.
I'm sorry, I'm facing some disturbance. You need to unmute or you need to mute yourself when you are not speaking. Okay. So, yeah, here there is no stabbing using a sharp weapon. There is no smothering. There is no strangulation using a rope. There is no. Okay. Now, what all things can you use for to smother somebody? Imagine this person is died of asphyxia.
Divider.
Mm-hmm. Yes.
Divider.
Divider. Divider for what?
For stabbing small marks.
As I told you, the man has not died of stabbing, dear. If the man has died of
Nails,
stabbing,
nails.
Ma'am, a pillow for covering
nails,
the face.
yeah,
For
okay.
asphyxia.
So basically, if you look at this particular picture, I will tell you some more examples. So you'll try to understand it more carefully. Okay, fine.
Maybe
So this you
button
already
or
have
hand
seen.
or arm.
Extravasation of blood in the neck muscles in the front part of the neck. Okay. This is in the soft tissue and thyroid cartilage. Now I'll tell you something which is very important. You should know some of the medical terms. You know this thyroid cartilage, basically it's present, okay, and this thyroid cartilage is a kind of cartilage which is C-shaped cartilage, which is holding your windpipe. Okay, the windpipe is your trachea and it is holding the thyroid cartilage is like a C-shaped cartilage. What is the hyoid bone? Your tongue is connected through one bone, okay, and that is the hyoid bone. Okay, so here in this particular case, what has happened is that this man's the hyoid bone is fractured. The hyoid bone is fractured, and also there is some kind of blood near the hyoid bone. I'm making it simpler for you to understand. Okay, so what must have happened in this man's case, that this man has suffered from asphyxia, this man has suffered from I'm audible to you, right, all of you?
Yes, ma'am.
Yes, ma'am.
So
Yes, ma'am.
okay, good. What must have happened in this case wherein the person's hyoid bone has broken, he has suffered from asphyxia, he has got his marking like this on his neck? What do you infer from this? Because of biting, can you kill someone by smothering? What is smothering? If I close your nose and mouth and I strangulate you, that is smothering. Okay, right? Is there any kind of that thing over here? What must have happened? Okay, let me try to tell you. Another thing apart from it, this man is also a regular homosexual. All right, this is the posterior old infected sinus at the 12 o'clock. That means when this was examined, it was observed that this is that particular portion, okay, in the rectum, There is zero healing in this issue. That means he was a regular person, okay, in the sodomy. He was a partner in sodomy. Okay, fine. All right. Next. So here, what was the important thing which was observed? Many people will not examine it. Okay, suppose if the history was not examined, that whether this person is a homosexual or heterosexual, the police officer must have missed it. Okay, but in this case, it was indicated. So that's why the autopsy surgeon took this thing task to see whether the anal fissure is there or not. Here you will see the anal sphincter is devoid of any rugosities. Anal sphincter is basically a sphincter. Okay, it's a very tight space. But because there is a continuous friction, okay, of the insertion of maybe penis by the other male partner, there is a loss of elasticity in that area, and you will observe the funneling of the anus is there. Okay, so there's a chronic anal penetration, and there's spermatozoa also found. Alright. Now I will tell you what is the cause of death. Simple thing is, it's a constant cause of asphyxia with smothering and manual strangulation. It is very simple. If you look at it here in this case, these are the nail, the nail markings. All right. And because this man was manually strangulated, but in such a manner that you will see the very faint thumb markings over here, very faint. Mostly what happens is, in a person who has a very fair skin, or maybe who's a female, they have very delicate skin. So in them, the fingerprints are very clearly observed. In this case, what has happened is two things: not just manual strangulation, but smothering also. So that is why you would observe that from his nose and from his tongue. I told you, right? The person who has killed this man has not only closed his tongue, but also has forcefully smothered his mouth. Because of that, his upper and lower lip is damaged. Okay, the frenulum is torn. What is frenulum? The lower lip is connected with a small flap of skin called as frenulum. So it is also torn. It is swollen up. And the tongue, he has bitten on the tongue. Okay, because he was smothered. Second thing, that this man was also, so like somebody had put hand on his mouth and nose and also manually strangulated. And that is why you will see here on this part there are more marks. Means on the right side there are more marks, on the left side there are less marks, because that is the part where thumb was there, and the another part is where the fingers were there. So there are the nail markings over there. So this is how you have to identify that what must have happened to this man. Okay, if both hands had been used and both sides equal pressure would have exerted, but that is not the case. So in this particular case, we'll observe that the person had actually undergone strangulation, manual strangulation, and the smothering also is present. Who had done this? Of course, his partner was interrogated, and the reason came out that his partner had murdered him. Okay, was he involved in the sodomy also in that time? No. So that was ruled out, because all these cases have some paraphilias involved in it. Sometimes what happens is that they might use some external stimulator or an external artificial male organ to stimulate and then conduct asphyxia. It is coming under the case of a case of, like it's a combined paraphilia. Okay, they are autoerotic as well as they are combining with the sodomy. So this is a special case in that sense. Okay. I hope you must have understood a slight glimpse of how do you see a particular case, right?
Yeah.
So just
Yes,
don't blindly say that it is you just don't blindly say that it is blunt force or something. You cannot say like that. You have to give evidence of why those nail markings were there, in what manner were they produced, why was nail marking more on the one side and less on the other side. That is most important for you to understand. That's how we can decipher a case, right?
Doctor,
Okay.
I have a question.
Fine. So we'll discuss questions later. Okay. Now, sodomy, yes, some terms you should be aware about it. Sodomy is an unnatural sexual activity between two males. Okay. Also between a male and a female. It is called as gerontophilia when the passive agent is an adult. So like if two consenting adults are there, it's called as gerontophilia. If a passive agent is a child, the child is known as a catamite. Okay. The terms you should be aware of. All right. Sorry. So now next case, this is another case. So another case history, we have to see it very carefully. This is a 30-year-old man who was found hanging from the ceiling in his living room. Okay, he was found hanging in the from his ceiling in his living room. And now I want you to observe what all things do you see near him. What will be your observation? You are the person who arrives at a crime scene and you see all this. You are that man who's or the female who's standing in the green colored dress. What is your observation? Yeah.
So, as I can see, there is lividity in the lower part of the body,
Mm-hmm.
red color. So, this person has been died before he fell.
Okay. Okay. And anything else? Is he clothed? Is he naked? If he's naked, what could
He's
your
naked.
is naked? What could
And I
your
don't think
brain?
that
Mhm.
I don't think that this is the case of someone who's fallen from the ceiling. No.
Basically, I'll tell you later about it. That what is the case that what has happened. Any other thing? Okay, here they have mentioned some external feature of asphyxia also are found. Of course, he was found hanging from the ceiling. Asphyxia is present. Okay, very common. Apart from that, this is something which is observed. What do you see on his hand? Is it blood? Yes. Can you all see the image?
This is
Nail
also
paint.
cyanosis.
It is
Nail paint.
Cyanosis.
nail polish, right? Nail paint, right?
Yes,
Now,
ma'am.
yeah, why would a normal person put a nail paint, male specifically, put a nail paint on his hand? Is this related to masculinity in any way? I'm not talking about any of the other things, okay? Don't drag this conversation to the LGBTQ topic at all because it is not that. It is something different. So,
I think I think this is not nail polish. This is due to the lack of oxygen. So it's maybe an advanced stage of cyanosis when
no,
the
no, no, no,
bluish
no.
color
It is,
will
it
turn to
is,
red.
it is not that thing. It is actually a nail paint. Like it is given that
All
it's a
right,
nail
all right,
paint. Yeah.
got it.
You could see the bluish discoloration on his fingers also. It is green and blue in color. You can see that. So it is not this thing. It is the nail paint only. So normally you should understand this term. How many of you are aware of this term transvestism? Cross
Heard
dressing.
about
Trans.
it.
Hmm?
Heard about it. It seems like when the nail paint picture I saw, I was just gonna say that it seems like a case of transvestism.
Yeah. Hmm. So you must have heard that some people are cross dressers. Okay, and they are enjoying this particular thing that they love to cross dress. Okay, they're desiring to dress up in a female clothing or a female attire. All right, fine. So this is important. Now
Ma'am,
here
also we can, ma'am, from a cultural point of view, there are some culture in our country where, especially during marriages, so and in that particularly talking about northern India. So what happens is that the male bride, I think, yes, male bride, they paint their nails as a ritual, like both their hand and toes. So they paint it in red color.
okay, okay. Well, that it's a definitely considerable point. But this man was divorced. Okay, he was divorced. He was living 30 years and age, something like that. And apart from that, you will find that there are some clothes over here. This is a woman clothing actually. It is not specifically shown here, but this printed floral print is actually a woman's clothing. Okay, fine. So now some things can be made out from this particular observation. The third thing is that on removing the clothes, there was extreme bleeding from the genitalia. And when it was observed, it was seen that in this particular case, there were parallel cuts. You can see there were cuts on the penile part and on the scrotum region. Okay. Same thing was observed. There was an extreme bleeding in this all part. So there were two things. Um, Investigation led to find that there was this bloody kitchen knife was found in his house, and he had used the same knife, okay, Now whether he has used, somebody else has used, okay, that we have to clarify. So basically suicide note was found in his diary and he was divorced and he was a transvestite. Okay, so all these things are pretty clear. Now there are two things. This man has not only committed once, he has tried to perform genital self-mutilation. You have to understand the term genital self-mutilation is the thing wherein a person tries to harm his own self. But because he was not successful and because he was not fully successful, he could not like mutate himself. So what happened is that he chose the way of like tying himself, okay, and hanging himself and committing suicide. Okay, so this is the two methods that he tried. All right, you will notice over here that this is a type of like the genital self mutilation. So some people are psychotic, okay, who are schizophrenic, they are committing this kind of thing. Self amputation is very common in schizophrenics. Some are transvestites, so there is a fear, there's a guilt, okay, there's some trauma associated with them, okay, and because of that they can commit this kind of thing. Or there are also cultural or religious belief with sexual guilt feelings, okay, and because of that also people can commit a genital self mutilation. All right, okay. Here, what are the psychopathic causes in this case? Okay, what might have been the psychopathic causes? um so sometimes there is an absence of competent male figure, so they are not able to identify themselves as a male. Okay, and because of that, they have a conflict in their mind that whether they are a male or a female. Okay, second thing is over controlling mothers. So this is like what is the meaning of masochistic behavior, by the way? Anyone has heard this term, masochistic behavior?
No, ma'am.
Okay. How many of you have heard the word sadism?
Sexual
Yes, ma'am.
gratification by causing, like by seeing others suffer.
Okay. So
It is a
basically,
form of pleasure that one often feels by seeing someone suffering from an external injury.
correct, correct. So basically, sadism is opposite to masochism. Okay. What happens is that in this case, sadism was like its name on the person, Marcus de Sade, who was a sadist writer. He used to write eroticas, which was sadist in nature, and who loved to who loved to give pain and derive sexual pleasure out of it. Whereas in masochism, it is different. They are enduring the pain to derive sexual pleasure out of it. And in many cases where the over controlling mothers are there, it happens that the male child specifically can have a masochistic behavior, which is submissive. Okay. And they are happy to accept that kind of behavior. So any person, not just mothers, any person who has kind of inflicted trauma in early childhood and taught them to derive pleasure from that kind of pain, converts them into a masochistic behavior in a later stage. Okay. Pathological feminine behavior of male child. So again, sometimes child's identity is misunderstood, leading him to have a conflict in accepting his own body as a male, and that can also lead to his degradation. Then his body image, so especially specifically like body shaming, or somebody has told something about the body and he has become conscious and he does not like that body, he hates that body. So because of that, a kind of degradation, self degradation can happen. Okay, sexual conflicts can be there. Maybe some people suffer from erectile dysfunction or impotency or some kind of other issue that can also lead for them to have an unresolved sexual conflict. So all these feelings and anxiety and feeling are often relieved by GSM. But not only these cases. I'll tell you a very interesting small case. Okay. We'll discuss that. What is this called? It's called as Klinger syndrome or Van Gogh syndrome, commonly called as like these two syndromes. And what specific is about Klinger syndrome is that it is mainly a GSM act associated with religious delusions. So, like self-injurious behavior based on religious delusions. Okay, if someone is maybe indulging in say masturbation, something like that, and that person comes to know that it is against the religion, then he might or he might actually try to perform GSM. Okay, And here it is observed that people who are involved in self-injurious behavior are not idiots. They are likable, they are known by people, they're intelligent, they're functional. Okay. But the point is that very often, and the times of stress are there, at that time, excessive anger is there. Somebody has said something or the other thing, and then a sense of powerlessness overcomes them. And because of that, these kind of expressions start coming out. Okay, so kind of low esteem or maybe an anger against himself or an insecure personality structure can also lead a person to have this kind of syndrome. Fair enough? But I'll talk to you about one more thing, one more interesting phenomenon. I hope you're not getting bored, all of you. Okay.
No.
Ma'am, can we say that this is
No,
also
ma'am.
example of lack of
Ma'am,
confidence?
I have a question in
I
the
missed,
previous case.
I missed a lot of questions. You have to ask me again, both of you, the two boys who were questioning me.
I have a question on the previous case.
Yeah, please go ahead.
Actually, you show that a hanging person in that like it's a partial of full hanging. It not
Hanging, like this man's case, this one.
Yeah.
It was a complete hanging. He actually
No.
died of asphyxia.
No, actually, I have a concern. Like, if the person is if it's a suicide in the sense like a ejaculation will happens and he may let out the natural. I mean, like a motion, such things. It's not there, and also it's the a mark in the neck, which is seems to be like a full. I mean, like a fully one.
No, the point, I agree with you. You are indicating out towards a pulley mechanism of autoerotic asphyxia. But here it is said that this man was found hanging from the ceiling. Ceiling is very far. He was literally hanging from the ceiling. So in that case, he didn't have an option of creating a pulley, or they must have mentioned about it. But there is no evidence of creating a pulley around it. He was simply lying, he was simply hanging from a nylon rope. And you can see that in if in case of like asphyxia, okay, nobody will pull it so harder until unless it is completely suffocated, and you might still find the nylon rope is around his neck. Here it is not there. They have actually cut open that particular rope and then pulled him down, because there was no other way he would have come down. Otherwise, if you are trying to describe an autoerotic asphyxia, which is common, but in that case, that rope or the cloth should still be there in his hand, which is missing in this case. Because of the rigor mortis, he will not leave it. So here it is missing. So in that case, we cannot confirm whether he was trying to do any kind of autoerotic experiments on himself, right? And also the nylon rope here, you can see the black discoloration is very high. So it is a very least possible case whether he has, died only because of pulling that cloth. First, the cloth is not available. Second, the mark is very strong. It is almost blackish in color. That means he had, because of his weight, he was hanging, and that has actually suffocated him, right? So he has died of clear-cut asphyxia. And by the way, he has used two methods. Okay, so like people who are not able to kill themselves in first attempt, they tried the other attempt, and this is very common in suicides. Okay, so if he must have first tried the GSM, genital self mutilation. He was unsuccessful. Because of that, he tried to do the second kind of suicide. And I'll tell you one more thing. If in the such cases, if the person is unsuccessful, he'll try to murder somebody because he has to release his anger somewhere else. So in many cases, this also happens that people who are trying to commit suicide, if they are unsuccessful, they try to they'll kill somebody else. Okay, out of their anger or rage or whatever it is. Right. Okay. So I hope I've answered your question. I think one more person was asking me one more question. If I can answer, if I can ask you. Any question, anyone? No?
Ma'am, can we say that in clean sore syndrome, it is also an example of lack of confidence?
Also? Can you repeat it? You need to repeat your question. I'm not able to understand what you said.
Ma'am, can we say that in clean sore syndrome or that Van Gogh syndrome, you said that teasing someone can also be demotivated them for their causes. We can say that it is due to the lack of confidence.
Yeah, lack of confidence, rather stigma. Okay, they might have felt bad for doing something. They might have low self-esteem. Many things are there. So Many reasons are there. Okay, some people feel that they are not a male enough. Okay, they don't have masculinity enough. That's why they can also come into all these things. So yeah, these things are happening. Okay, so I'll describe about it. I have to complete the case. We'll discuss more about it. Let me just complete it quickly. Anna. So this we have discussed, but one interesting case which I was going to discuss with you is this: male genital self-mutilation due to tomophobia. This is very interesting case. So here what happened is this 45-year-old male, as you can see, he is absolutely naked and this thing, but you'll observe the extreme bleeding in the lower portion. Okay, so he's conducted a GSM again in this particular case. So he was found deceased in home in a pool of blood with knife and pair of scissors lying next to him. You can guess what he's up to. And a part of, and in addition to this, a part of intestine were found next to the body. Right over here, you can see his intestines also are lying out over here. What is the reason for this? So patient was actually diagnosed with hydrocele and had a known history of tomophobia. How many of you are aware of tomophobia? Yes.
One who has feared for surgeries and operations.
Yeah, so the man was very fearful of surgeries and operations, and he wanted to take matter in his own hands. So what he did was that he incised, own scrotum, and in that process, the herniation of the intestine might have occurred, and because of that, he has pulled his intestines also out, leading to excessive bleeding from his body, and of course, death. So, of course, these cases are very, very, very less, rarest to rare, I'll say. It's very rare to observe these kind of people. And self-orchidectomy, this is actually what is called as the removal of testicles and etc. is self-orchidectomy, and it is often associated with the psychiatric illnesses, right? Okay, so in this case, many times when people go at the crime scene, they assume, oh, somebody has murdered this man and then he was trying to mutilate the body. But then when you go back to all the history and you see this man has had a history of psychiatric illness, and because of that, he has done this particular, thing. Then you understand that, okay, this is a kind of suicide that he has done, along with self-amputation and mutilation. Okay, fine. All right. So now, if we have time, I don't know if we have 5 minutes, we have to discuss the case. It's a very, very small case actually, but it is interesting because here it's not just a rape, it's a okay. I'll discuss it like this. So a victim in her mid 40s was discovered by a 21-year-old son. Okay, and she was found in basement, and her body was totally nude, and also she was her head was wrapped in a multicolored pillowcase. So pillowcase was there. Basement में pillowcase present. A pillowcase being present in a basement is of course a very unnatural phenomenon. Still, it was there, and her neck area had been tied with a telephone cord, of course, to strangulate her. Then her hands were also tied with the telephone cord, so it had been knotted. Okay, now her feet were also tied with telephone cord, and there was pooling of blood near the head area. All right, now you will see that here, this is the area where her body was found. Okay, this is the kind of area her body was found, and this is the case, the pillowcase. Okay, which was found. You'll see there's a lot of blood, lot of pooling of blood around her head. Near her hands, you see her hands are very securely tied, her feet are securely tied. Now here, when the body was turned, this head is completely damaged. It's like pillowcase was absolutely soaked in her blood. It is seen that she was stormed as in somebody has literally tried to smash her face. Okay, what do you think? What object might have been used? Can you see something nearby? Anyone? What must have been used?
Stone.
Ma'am,
Do you
stone
think?
slab?
Do you think this is used?
Seems so, ma'am.
Ma'am, blood will be
It's a
there.
big one.
Is there any blood on it?
No,
No.
ma'am.
No, ma'am, there is
Then
no
the
blood
murder
in
weapon is not,
the
I mean, that is
Phone,
not a murder
phone,
weapon.
Correct.
phone maybe.
Maybe a phone. Okay, but just a phone can it cause this injury?
No, ma'am.
So what can this be? What kind of injury? What kind of activity can lead to this kind of injury? Any idea?
Are they
Like this,
both?
so see, this so the scalping is done after the autopsy. Okay, but this much amount of bleeding, not the scalping part. Okay, scalping means removal of the skin is not done by the injury. I'm saying that much amount of bleeding. What do you think that much amount of bleeding, and her entire face is disfigured, and so actually here it is written stomping. So I hope you understand the meaning of stomping. What is stomping? So have you heard about children like stomping their feet, putting their feet like on the floor and banging against it, right? So that is called as foot stomping or stamping. Okay. In this case also, what has happened is that the person has excessively hit her head. Okay. In fact, like jumped basically on her face and kind of tried to create this impactful injury. Okay. Reason can be anything: disfigurement of the face, non-identification of the body. But why would he leave the body in her own house if he wanted to not identify? See, this is a classical impact. And now I will tell you what you have to observe. This is a case solved, like clear-cut case of rape, of course, and murder. Also, the body has been mutilated to certain level. Okay. You know why? What is the suggestive of? First of all, in autopsy, it was found that there was some amount of brain edema and herniation. This means that she was alive after some time of this much amount of injury also. Okay, she was alive and she was enduring the pain. Second thing is that what can be the main cause of death in this particular case? So autopsy has listed all these things, that there were blunt force, head trauma, there was abrasion, laceration on the face, there were cuts and everything. Extensive subscapular damage. So beyond scapula, there was an extreme huge amount of bleeding below the scapular layer, and skull fracture had happened. Skull fracture can only happen when there is a blunt trauma involved. Either the man has used some kind of bat or something, but since it was not found at the scene, it is believed that there was a person who has conducted this rape and he has stormed on the lady's face also. But just one man doing it is very rare. Second thing, bilateral subarachnoid hemorrhage. Again, the same thing. There has been a lot of bleeding inside the brain layers, brain meninges, and lastly, there was contusion and edema. So all this indicates to one final thing. That means this lady has suffered from grievous head injury, and that has led to her death. Not the rape, not the tying of the hands and feet. Now, more important for us to understand is that why would a person leave the body like this? This is very essential for all of us to understand that what does the offender try to tell from his actions. First of all, he is unprepared. He has used the telephone cord which was found in the lady's house only. Okay, he has ripped off the telephone. Two things: she cannot, nobody can communicate, and the telephone cord is used to wrap around her feet and legs. Okay. Second thing, that there is no use of any external weapon. That means there was no preparation as such, that they will come and then they will rape. And okay, why am I using the term they? It might be the work of more than one person, because to create that much amount of injury on a single person body, okay, specifically on the head. Why I'm saying this? Specifically on the head, this much amount of injury by one person is very rare. Okay, and in this case also it was found that it was like a kind of gang which was involved, who had committed this entire crime. Okay, also you will find that the exposure of the body was in a particular manner. The body was left open. Okay, there was no covering. At least a bed sheet could have done the job, but they tried to leave the body open. The reason is, it is not for the body. Okay, it is for two things. First, the as I already have, like many early cases I've already told this, it is also first disfigurement. That means not allowing the identity of the victim to be revealed. Okay, like you treat the victim as an object, you destroy it as much as possible. Number one. Number two, degradation of the victim beyond a human. Okay, it's like if you don't consider the human even as a victim, you degrade the body like anything. Stage it like in a very embarrassing way, that this lady will be discovered by some of the family members because she is in the basement. The shock and the embarrassment to discover their own relative in such a way will stay with the person who is finding the body. And that is also a kind of message which the offender wants to give. This is very interesting to observe. Okay, because in one more case, it was seen and that was discussed. So basically, what was happening is that in that particular case, what was happening is that a person who was on divorce terms with his wife, so he had some issue and argument with his wife, so he came and then he murdered the woman. Okay, and he had taken that date his child to the park. Okay, meanwhile he came back for a few minutes. He had an argument with his wife. He murdered the lady. Then he dragged her all the way to the bottom basement, something like that. Then he ripped her clothes off as if to show that it's a murder. And then he reported, then he went back with his child, brought him back, and then he, reported the crime. The investigator in this case was a very famous American forensic investigator. And he immediately understood. And he said that this is the work of the husband itself. Reason being that in this case, what happens is that the husband didn't want the child to feel the embarrassment of discovering his mother in that manner, because that trauma will stay with him for lifelong. So what he did was he dragged the body, killed the lady, but he dragged the body all the way from the house to the basement so that his child will not see that, but he made it sure that it looked like as if it was done by some other person. So this tells you all the crime scene. What I'm trying to discuss over here is that they tell you something or the other about the psychology of the person who has done the crime. And one thought is very famous, that whenever you're trying to find a way to solve a particular case, you have to actually think like a criminal. But it's very difficult not to become one. Okay, of course, all of you who are reading this today are not criminals actually. Okay, right? So they are not intending to, commit a murder or commit a crime, but then you have an interest in this which is different from the other people. You're able to see all these gore pictures because you are curious to know about it, and some or the other way it is linked to the other criminals who think about the in the same manner. Like I'll tell you a few criminals, you'll be blown off. Many of the criminals find it interesting to perform autopsy and surgery, and they are very much fascinated by human organs. Okay, so in one famous case, I don't know, we'll discuss it later maybe because time is running short, but you can read the case of not Jeffrey Dahmer, another guy. Yeah, Jeffrey Dahmer. Sorry, Jeffrey Dahmer. So I think you must have all heard about Jeffrey Dahmer. Have you heard about him?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Not a very famous or very renowned person, but of course the issue is that in this case he was attracted to the glistening surface of the internal viscera. Okay, he was attracted to that, so he had a fetish for that, and that's why he murdered. So, like, many cases are there where you find necrophilia and all these abnormal things happening, wherein people are curious to know about it, and their curiosity can lead to the crime. Okay, so I'll wrap my session here. I hope you have enjoyed certain things. Always try to analyze whatever news you're reading. Don't just read it as a news. Try to analyze what are the background things in that particular case. Why would a person do that is more important than what he did. Okay, always remember why is more important than the what. All right, and that is how you will always realize that the case is different from the facts which are being presented. So that's all from my end for today. I don't know if I have answered your doubts clearly or not, but I'm sure that you must have enjoyed the session.
Ma'am, there's
And
one question from
yeah,
the audience in the chat box. I'll just read it out to you.
sure.
It's from Dr. Satvik Chatterjee.
Mm-hmm.
To what extent can advancements in medical science, particularly in neuroimaging and genetic testing, enhance our ability to identify psychopathic traits early in life? And how might this knowledge influence global criminal justice policies and ethical standards surrounding intervention and treatment for individuals at risk of developing criminal psychopathy?
See, first of all, neuroimaging. So there's this Dr. Adam, who is conducting neuroimaging on the people who are suffering from schizophrenia and the criminals. So like there have been some, still now in psychiatric evaluations, there have been very less methods wherein you have used MRI images to understand, or brain scans to understand whether the person is actually having some mental defect. But you know what? This thing does not work on everybody. I cannot catch every random person who's a rapist and say, "Chalo, let's do his MRI scan and prove that he is psychopathic." It is not like that. Okay. Sometimes it is also the upbringing and the social upbringing in that case. Now, if I say that in the Nirbhaya rape case, the people who had murdered Nirbhaya, were they all psychopaths? No, they were bus drivers and bus cleaners. How will you prove that they had to undergo a neuroimaging or genetic test scan? And genetic testing is a very strong word. Okay, that means if you are saying that the genes have transferred from their parents to the children or something like that, in that case only you can mention this particular term. Or else if we can say, because of the, like, this thing also, again it's a theory only, that the chromosomal presence of XYY gene, Edward syndrome, was found in some cases, and that was related to criminal syndrome or some other syndrome, because of the excessive production of testosterone. But that doesn't guarantee that you can always tag somebody that, oh, this is the man who is this kind of genes and he will develop into a criminal. Never. You don't have a particular set of gene testing anyway to confirm that bias. You can develop some methods to neuroimage to find whether the person has any kind of tumor, has any kind of schizophrenia, has any kind of other psychiatric disorders which have caused severe brain damage. Okay, that can be done, but not in all the cases. Some are just revenge murders, some are just lust murders. You can do nothing about it. Okay, it's all about the social traits. And as far as I say, social traits and criminal justice, basically what happens is that criminal justice policies, yeah, they can be reformed, but you should have a lot of research and a lot of knowledge and background work into that. Okay, it's very rare to prove, like, in many cases now also you will read, and I really request you guys to please go and read the end of the trial cases, not the starting of the cases. Like in Nithari case, is the convict still inside the jail, or is he out? Is out. Okay. Is in the case of the some Tandoor case happened, is the convict inside or out? Was he convicted of a murder? He was, because evidence was there. But in other cases, when evidence is not there, you cannot convict anyone, and you cannot tell them to undergo an neuroimaging, because it will prove nothing. Okay, you cannot prove that, oh, okay, this man had been acquitted of convicted of cannibalism. Is he really doing cannibalism or not? How will you prove that? So, see, there are so many things and so many factors. The only thing that can be done in this case is research about the criminals who are already performing these activities, and perform a medical clinical create a database on them at least, right? In rarest cases, I'm not saying on all the cases, but in rarest cases, as you can find, you have to create a psychiatric clinical profile, you have to create a psychological profile. Okay, and then try to see that which of the following red flags are there. If a person is eve teasing, okay, he's a prominent eve teaser, he might someday develop into a potential rapist. So that is a clinical evaluation that should be done. That is what I normally say for starting of the criminal justice. And treatment is, um, either you are putting them in prison, the best way. You don't allow them to roam in society. You cannot treat an individual, to be honest. This is the way that they are brought, and the way now you can reform them using some social welfare methods. You can introduce them to pets, etc., but then you cannot ensure that they will remain like that. So I know it's challenging, I know it's tough, but it's a field which is still evolving. And to be honest, in India, I wish that these techniques come faster, that we start neuroimaging the criminals also, but it will take time. It will take time. But before that, we have to rely on the counseling of the criminals strongly, right? That's from my end for today. If you have any questions, okay, there are many questions. were possible to request access to video. So let me tell you something. It is very, very difficult that see, it's postmortem is not like a it's not like an operation or a surgery. The problem is that postmortem is under a legal jurisdiction. You cannot record any kind of postmortems. Whatever autopsy you see is a case which is already undergone a trial, or maybe identity is not disclosed. Okay, so it's very, very tough that you get a actual video recording until unless you are sanctioned to view that. Okay, that means you belong to a particular department, police or maybe forensics department, specifically in the autopsy section also. That is more important. Okay, thank you. You liked my session. Ma'am, can you please tell us what are the common myth in postmortem? Yeah, I see a lot of people on Instagram telling a lot of nonsense stuff, on postmortem, and I just hate it because they have zero conceptual idea on what is happening in postmortem. So in postmortem, like it's just like any other autopsy, or postmortem is nothing but like, see, autopsy is like you are conducting autopsy on dead body. Postmortem findings are actually correlative to the death of the person, whatever findings are there. There are a lot of myths. We can have a separate session on that altogether. As much as myths as you can find, I can try to find an answer for them. That would be a good way. Also, ma'am, okay, we cannot access the video recording. Postmortem examination, okay. Can you please, Sayana says about the behavior analysis in case of psychopathic crimes? As I told you, each person has their own behavior. Okay, it depends upon what kind of person is, involved into all this behavioral aspects. Now, suppose rape. Okay, would you say that person's behavior profiling, if we could have stopped it? I would say yes. Yeah, the person who was 19-year-old or maybe 17-year-old juvenile at that time, he was the one who had pulled out the intestines of the lady. If he had been given a capital punishment that time, no other person would have tried to, do that particular thing or repeat that. So, it is important that the behavior is always modified by punishment. You can never modify a behavioral issue by just giving them psychology. I cannot talk to you. I was talking to a person who was a rapist, and he had zero remorse for raping his own daughter and for raping his daughter's friends also. Okay, you cannot talk to these people because they have zero remorse. What will you do about it? Okay, you feel bad about the social system, but then when you really, that's what I'm saying, right? You should talk to people who are giving you conflicting statements, because that is how you realize what this person can think and what's the level of thinking that he can dip down to. That's how you realize, and that's how you talk to people and you come to know. So you should talk to as many people as possible, specifically in the different types of areas. Okay, and that's only possible when you counsel them. So not like questioning. Okay, you talk to them, you understand, you try to see if they're lying, what are their manipulative skills, and for that you have to watch and see people's movements, their manner of storytelling, etc., etc. Okay, so I have dragged the session a lot. Ma'am, don't you get affected by such disturbing case and imagery? See, I cannot say that I am absolutely immune. Of course, people get affected. I personally got a case of a 2-year-old girl child who was raped, and like she was badly mutilated. A glass bottle was inserted inside her private part. I could not bear it because I was very angry, and I wanted to give the best punishment possible to that particular man. But that is not in my hand. What I can do is that I can just hand over the report, which is honest. That is what you can do, right? You get affected, but then you don't have to let that particular thing affect you. That is the difference, right? You have to think like a criminal. You don't have to behave like one. So that's the point, right? So yeah, same here. I think I liked the session with all of you. It was amazing. Mental disorder. Does neural scan MRI help? We'll discuss about the MRI scans in the next lecture, maybe sometime if we conduct it, which will be really amazing. And we will do this MRI. Actually, it's a very less studied topic, but now MRI and AI is being connected. So somehow in future we will see that we'll have a criminal databases of people with the MRI scan already being done. So for a reference, at least we can use it. And if person has this kind of brain scan and he has done this kind of crime, so maybe he has done, or he might potentially also do this kind of, this person might do that kind of person's like behavior. He might act in the same manner. So yeah, and AI. Please research about this one more thing: forensic, psychiatry, and AI. It's a very interesting topic upcoming one. So AI will also help us some or the other way. Let's see how. Right. Okay. So I hope you liked my session, and thank you so much. So now I will hand over the mic to organizers. That's all from my end.
Thank you, ma'am. Thank you, everyone. As we come to the close of this enlightening session, it is my deep privilege to extend our heartfelt thanks to Dr. Paridhi Billore, whose expertise and insights have made today's webinar on psychopathy and crime a truly memorable one. I now request Ms. Swagata, Editor-in-Chief of Why Crime Media, to present a token of appreciation to our esteemed guest. Accept this token of appreciation as a symbol of our gratitude and appreciation for your outstanding work. Dr. Billore, your ability to break down complex concepts in forensic psychology and forensic medicine and its integrate nature has been nothing short of remarkable. The depth of insight you provided on psychopathy and its role in crime was both thought-provoking and invaluable. You have given us all a new perspective to approach the subject of forensic medicine. Each case study and concept you explored today, including sanity and psychopathy, enriched our understanding, challenging us to think more critically about the factors driving criminality. On behalf of the entire Forensic Fusion and Why Crime team, and all those who participated in today's session, we express our deepest gratitude for the time, energy, and enthusiasm you have poured into this lecture. I'm sure today's discussion has ignited a spark leading to an astute chain of thoughts. Thank you once again, Dr. Billore, for being with us today and for sharing your wisdom. We look forward for further more opportunities to learn from you in the future and wish you continued success in all your endeavors. Thank you once again, everybody, and have a great evening ahead.
Good evening, ma'am. Thank you so much.
You're welcome, everyone. Thank you. Goodbye. Good night.
Thank you, ma'am.
Bye, ma'am.
Goodbye.
Thank you, ma'am.
Thank you
Goodbye.
so much, ma'am.
Thank you, ma'am.